So at the start of our meetings, we always begin to frame our conversations during the meeting to hear from people who have used our services. And I'm really pleased to welcome Dougle to join us at the board meeting. And Dougle's going to talk about the experience of him and his family, and indeed his father's end-of-life care with our hospice. So Dougle, if I could invite you just to tell us a little about your experience, and then hopefully we can have a little conversation as we get going. So if you'd like to unmute yourself, and over to you, Dougle.
Fantastic. Good morning, folks. Please bear with me. I'm not an expert at this, and I have a degree of autism, which doesn't really help. But I want to give you a little bit of context about myself and my father and where we was coming from before we arrived at John Eastwood Hospice. I've spent what feels like decades battling with the local NHS management and social services, trying to get an appropriate level of care for my dad and for my wife. And it is a constant and never-ending battle. Dad was at his wit's end, and we'd tried every single thing that you could think of, social services, the King's Mill, absolutely everything. The only thing that we hadn't tried was a hospice. And I think because of my age and because of my experiences around hospices back in the 70s, I didn't really think that would be an appropriate place for my dad to go. But we was incredibly fortunate that one of the nurses from the hospice came to visit us in his home and had a talk about what they could do. And she took one look at the pair of us and said we both needed a little bit of temporary respite. And it was quite a tearful moment, because she was the first person to actually acknowledge just how far we'd deteriorated down the line, how desperate we were for any form of support or care. And she was very honest with us. She told us about the waiting list and how things worked. But strangely enough, within a couple of days, we got a phone call back from John Eastwood Hospice, who asked if I could get my dad down quite urgently because they'd just had a vacancy open up. So I pulled a few strings and we got Dad down there, and it was just before Christmas. We expected Dad just to be in for maybe a week, maybe 2 weeks, so we could get him back home and I could carry on with my caring role and pay for external carers. I think Dad was in the hospice for maybe 24, 48 hours before I had a conversation with one of the nurses there that they was a little bit concerned about his state of mental health. And I personally couldn't see it. I didn't understand it, because when we brought Dad in, when his medication was changed, yes, there was a change in his mental health, but in general, he could have a joke, he could have a conversation, he could make his own decisions. So for such a big change to happen so quickly with no major event attached to it, I didn't really understand, and it sort of set those alarm bells off in my own head. I am a teacher, I'm a biologist, and I've always said when I've been talking to the NHS that, you know, a little bit of knowledge, it can be quite dangerous, because I don't fully understand what the doctors are explaining to me, but I know enough to ask certain questions. So I think my sensitivity was probably heightened in the build up to Christmas. But it was quite clear almost instantly from the conversations with the different nurses and the different doctors that the period around Christmas was going to be all about my dad. It was about keeping him happy, keeping him safe. They put in different changes. They'd assessed him for falls risk, so they'd put him into a bed where he could be observed. and they really did make it about him, to the point where he had Christmas hampers. You know, he was surrounded in Christmas hampers, and we had nobody that we could give them to. He couldn't eat them, and the nurses, you know, that they had a huge pile of Christmas hampers where patients had passed them on to the nurses. So whilst nobody ever wants to go through that at Christmas time, it couldn't have been any better. The all of the support, all of the care was to make sure that I had as little stress and Dad had maximum support for that period of time. As we came out of Christmas, that's when I started to see the specialist doctors, and they started to explain to me what had happened and why it was such a sudden onset. And they worked with me on in terms of the chance to try and get Dad into a home, which we was quite happy to move forward with. And each week, because of COVID, the homes were full, or the ones that had become vacant had suddenly had a COVID assessment, and it got to the point where we was desperate just to find a place for Dad to stay. And during that time, Dad also developed COVID. But the level, even though I couldn't see him, the level of care and the level of information, the level of support that I got was phenomenal. At no time was I any more concerned. You know, I think I had a natural level of concern, but it wasn't overexcited by a lack of information or not being able to see Dad. So I think that was absolutely phenomenal. And I'm just conscious at the time, but I think what I want to drive home is it didn't matter whether I spoke to a cleaner, to a doctor, to a nurse, to the reverend. It had no difference who I spoke to. Every single member of staff was utterly supportive, was very genuine in the level of help that they wanted to provide, and had an appropriate level of concern both for myself and for my Dad. And for me to say that, you know, it was an utterly remarkable time. Nobody wants to go through it. Nobody wants their dad to pass away during it, but it could not have been any more supportive or better than what we received. And I think my final comment to one of the doctors were, whatever you're doing in terms of management for this unit, please take that and transfer it to Kingsmill. Then we wouldn't have all the issues that we've currently got, because there's always a couple of tweaks people or departments can do to make things better, but I don't think there was in this situation. The nurses showed good, appropriate level of humour. They were very real. They were easy to talk to. And if I went and spoke to a different nurse on a different day, they didn't tell me something different. Everything was congruent from beginning to the end. So whilst it was a traumatic experience, I see today, and I know my dad would see today, as a reason to celebrate something that really was genuinely supportive and helpful, and had, you know, was incredibly kind of everybody at an amazingly stressful period of time. So I really wanted to take this opportunity to thank everybody for the work that they're doing, especially all of the staff in John Eastwood's hospice. It was amazing. My wife's been in there for day visits when day visits were allowed, and she had the same experience. So I think there's a real congruency coming through at every single level of staff within the hospice. So keep up the fantastic work, folks.
Dougal, thank you so much for sharing that really important story with us. And you know, I really do appreciate you taking the time to revisit that, like you say, an incredibly difficult time for you and your family. But you've really eloquently talked about how the team at the hospice helped support what I would term a good death, which is a really important piece. I also appreciated what you said there about taking the good management lessons and seeing where else they can go. So if it's okay with you, I'd just like to open it up for some comments and or questions from one or two colleagues around the table. Who'd like to start us off? Jan.
Thank you, Paul. So thank you, Dougal. That was very moving, and I also lost my dad during COVID, so I can relate to your story. And I wondered, you said at the beginning that initially it was due to be a visit, a respite visit, but obviously it then extended, and your dad stayed there. And I wondered whether that was something that was discussed with you. I know you couldn't get the care home provision. Was that something that you as a family were happy with? And, you know, was that all done hand in glove with you in terms of planning how your dad's care would take place?
But I think that's a really relevant question, because the level of care was so good at the hospice, we didn't want to leave the hospice. It genuinely was that. However, we also appreciate that resources are in demand, and that at some point that he was going to move into a home, and we wanted to move him into one that other members of the family could access and see Dad, but that was close enough for myself with my demands so that I could get there almost at a drop of a hat. And that was the difficult point. We was quite prepared to make the move, but if you ask me, did I want to make the move? The answer would be no, because I could completely trust what was happening at the hospice. And I knew that if anything went wrong, or if there was an issue, that I would get a call and I'd be able to go and see him in the evening, as long as he wasn't on the experiencing COVID at the time. That was the only time that I couldn't see Dad, was when he actually had COVID.
Great, thanks for that. I'm going to invite Sue Sunderland in, who's on screen as well.
Thanks, Dougal. It was really good to hear about your experiences. I just wondered if you could tell us a little bit more about how you got in touch with the hospice. Was it yourself that ended up chasing it, or was it recommended to you by one of the other contacts you had? Because it sounds like things were getting a bit desperate, and it's whether there could have been an earlier contact made.
It was a little bit by accident. We were in a battle with social services because they'd given Dad a level of care that was actually dangerous, and we'd flagged that up as a cause for concern. But what had happened over the last maybe 6 months or so, we had a respiratory nurse that used to come out and see Dad, and she was really good working with me, and she was very blunt and direct with Dad, which worked really well with Dad. So she had a really nice balance for both of us. And we got to the stage where she said to us, the only thing we can do for him is provide him with oxygen. And if oxygen isn't suitable, then we would have to give him we would have to consider end of life care. And it was at that point she managed to contact the nurse that came to see him for the respite care, that they were talking to each other behind the scenes. So I think, in spite of the low level of social services and the low level of care from King's Mill, there was people working with the community that was coming into Dad's home that were talking to each other, and they bridged that gap and made sure everything went smoothly. Could it have been done any earlier? I think if we took away everything that was happening from social services, I think the timing was actually about right, because nobody wants to approach that end of life care too soon. With everything that was going on with social services, I think if any of the nurses had been in during that time, they would have picked up on things going dramatically wrong, and then again would have taken the shortcut to put things in place. So I don't think it was ideal, but I don't think realistically from the respiratory side or from the hospice side, anything else could have been done any differently.
Great, thanks for that, Dougle, and really hear what you're saying there about the experience of needing all the different services to be able to work together, just to make things move as smoothly as possible. Okay, just to round things up, John, can I just invite you to reflect on that as Chief Exec?
Yeah, thanks, Paul. John Bruin, Chief Executive. Dougle, thanks ever so much for sharing your story and your family's story. It's really powerful, and whilst it's really heartening to hear that we do have services that do what they're meant to do and to serve people well, I think our task as a board is to pick up your nuggets that we need to be able to clone it, don't we? So that, because we run many other services, perhaps not quite so well, shall we say, because we're always striving to improve and to be better. So I think for us as a board, there's a conversation about how we can distill out some of the key messages that we can learn from John Eastwood, because it's a really emotionally charged and difficult environment to do well. So it's always gratifying to have such great feedback, but our task is to make sure that we can spread that wider across the trust. So thank you for taking the time to help share your story, and on behalf of the board, wish you and your family all the very best for the future. Thank you very much.
Yeah, absolutely. And Dougle, we will hold you in our minds throughout the rest of our meetings today, because there are some really helpful, gentle challenges that you've given us, which is really helpful for us. I really appreciate you saying that you thought that your dad would reflect positively about this too.
Yeah.
Yeah.
He told me on more than one occasion he felt safe, and he knew what was happening for most of the time. So thank you.
That's great. Well, look, Dougle, we'll let you get back to the rest of your day. Thank you so much for taking the time to join us and for sharing such a powerful story with us. It's very, very much appreciated. Thank you
very much, folks. Have a good day.
Thank you.
You too.
Bye-bye.